Good evening, welcome to your Health Matters. I'm Tasila Tembo Peters, and today on the program we continue looking at diabetes or sugar disease. And on the program we're going to look at how this disease is managed. But before we look at the management, are there any complications of diabetes?
In most cases, diabetes is one of those conditions where people, by the time they present to the hospital, they already have some form of complication of some sort. The commonest organs which are involved with diabetes are the eyes, the kidneys, and the heart. Sometimes also skin conditions or some form of severe infection. Those are the things that people come in with as complications.
Let us now look at how diabetes or sugar disease can be treated.
The treatment for diabetes is actually by either taking a tablet or some medication, which are generally called oral hypoglycemics, such as Daonil. Some individuals will need injections of insulin, and those are in combination with diet. You have to combine the diet combined with either an oral tablet or an injection. But what is important to note also is that every individual who is a diabetic may at one time need to be on injections of insulin.
And now the doctor is going to explain the relationship between hypertension and diabetes.
Well, the relationship between hypertension and diabetes is that in most of the cases, the target organs, what we call target organs, or the organs which are affected in hypertension and diabetes, tend to be exactly the same, which are the brain, the eyes, the heart, and the kidneys. So that's the major correlation between the two. In terms of males and females, both of them are at equal risk, okay? But when you look at individuals who have obesity or those who are overweight, they tend to be more at risk, and those people who actually take a lot of foods which contain a lot of carbohydrates, or the things like our regular nshima and rice, pastas, and junk foods. Those tend to have a more tendency to develop the diabetes. The other group of individuals would be people who may have pregnancy-induced diabetes, which is a special group which is stimulated or activated by pregnancy. When an individual has been diagnosed with diabetes, this is not a curable disease, it is a manageable disease, and the treatment is to prevent complications from occurring early. The other thing that individuals should appreciate who are diabetics is that they should stick to their diet and make sure that they monitor their sugar levels through regular visits to the clinic, as well as eating the right type of food.
And now the health tip. Once you have been diagnosed with diabetes, please visit the nearest health center to have your sugar checked on a regular basis and follow the doctor's advice on diet and medication. We have now come to the end of our program. We are ever delighted to hear from you on this or any other related health issue.
Contact the producer, Your Health Matters, PO Box 30205, Lusaka, or email lacom.health@gmail.com.
I am Tasila Tembo Peters, and from me, it's good night and God bless.